Hi, I'm Ian Bradford and I've looked after hundreds of patients who've had hernia repairs. I've distilled from this 5 key tips that I think you might find quite helpful on your journey into recovery after hernia surgery. My first tip is to consider that pain journeys are a bit like car journeys. What do I mean by that? Well, what I mean is that when you're in a car, you know you have to give it a bit of throttle to get it moving. But once you've got it moving, it's a bit easier to keep it moving. So when you leave hospital, you will have been given quite strong pain relief to get on top of your pain, in other words, to get it moving. But it's up to you to start maintaining that movement. Just as you do in a car, with a throttle keeping your car moving along a road, you need to keep your momentum going with some pain relief. Now, every car driver knows that when a pain mountain appears in the distance that's going to be difficult to get up and over, you have to get a bit of speed up to get halfway up that hill, and then maybe you'll have to floor it a bit halfway up and get over the top quite quickly. Nobody likes to be stalled at the bottom of the hill. Well, the same applies to your pain relief. If you're not maintaining your momentum because you're trying to tough it out and be as hardcore as you can be, you will be stalled at the bottom of a mountain when it gets unpleasant. And then you're going to need a lot more of pain relief, and it'll take you much longer to get up and over that pain mountain. So, pain journeys are a bit like car journeys. Tip number 2 is to not rely on just one drug, but to use several different kinds of drugs for your pain relief. What do I mean by that? Well, we know from the science of pain relief that using combinations of different classes of painkillers like anti-inflammatories, paracetamol, codeine, tramadol, using these combinations works synergistically to try and get over your pain. And they work far better than just using one drug and then doubling the dose, tripling the dose, quadrupling the dose. In other words, combinations work well, and they work better than if you use one drug only or 2 drugs and increase the doses of those drugs. Tip number 3 is to rest up for about 48 hours and then get moving. So why do we have to rest up? Well, after surgery, there are obviously raw areas inside you, and those raw areas have very raw exposed nerve endings that have been cut and little capillaries that have been sealed. And when you get oozing from a wound or you get stimulation to nerve endings by movement, you're going to increase the amount of pain that you experience. So rest up really well for 48 hours. Just put your feet up on a footstool, lays back in a recliner. But you can get up to go to the toilet, you can get up to get something to eat, but try and stay off your feet for 48 hours. Now, at 72 hours, in my view, you should get moving, because if you don't, things are going to stiffen up. And stiffness is a cause of pain, but also a lack of mobility, and getting out there means you're at risk of some other complications. So get out for a walk at least once a day, try and stretch your legs, try and just go for a nice gentle stroll down the street, but loosen up by going for a walk at least once a day, but wait until the 3rd day for that. Number 4 tip is about stretching. Now, we stretch because the wounds as they heal tend to tighten and they tend to shrink as scars later on. And if an area like a groin has been operated on, it gets very stiff and you may not get all your function back, so you'll need to stretch a bit. And the sort of stretching I'm talking about is perhaps stretching that's either extension of your torso, maybe some tilting to the sides, maybe bending, maybe rotating. But what you want to do is do it very slowly and very carefully. Just take it to a point that you can feel it hurt a bit, hold it maybe for a count of 10, and then just return yourself back to a neutral position. Twisting will help to pull on tissue, help your brain to acclimatize to stimulation from that area, and you'll get a lot more flexibility and function back again. Now, final tip is just for the men. Tip number 5, that is to wear some supportive, tight underwear. Perhaps you've got an old jock strap lying around somewhere. Maybe you've got some budgie smugglers from your togs. Maybe you've got some lycra from the gym, but you want something that's very tight and supportive. I won't explain how it all works, but you'll thank me afterwards. So those are my 5 top tips, and I hope you find them useful on your journey.